policy of the Veterinary Council in South Africa. She has so many numerous leadership experiences, and she would be here with us today to tell us about her leadership experiences from South Africa, her experience with the Solo Agricultural and Rural Development Institute, where she uses her expertise in agricultural education and policy development. I've been very privileged to meet Dr. Nandipa in person, and I'll tell you that she's a very awesome person. So just be ready, like get your notes ready, get everything ready to learn. So welcome, Dr. Nandipa. And you give a clap emoji to welcome our very wonderful guest. Thank you so much, ma'am. And so I would love to introduce a father in the veterinary profession in Nigeria. He's a father, he's a role model, he's a mentor to a lot of veterinarians here in Nigeria, and that is no other person than Dr. Gani Enahoro. He's a certified entrepreneur and the alumnus of Nigeria's foremost policy think tank. In that name, is giving so much energy. And yes, so he has a lot of experience. He was the president of the Nigerian Veterinary Medical Association, the NVMA, and he's also a consultant senior of the animal health specialist at the Food and Agriculture Association of the United Nations. He has more than 40 years experience. As I told you, Dr. Gani is a father, a mentor. Like for someone like me, he's a grandfather in this veterinary profession. And so we have so much experience, and he also engineered and piloted animal-related businesses for major international oil companies like the Shell Petroleum Development and Chevron Nigeria Limited. So we have Dr. Gani with so many experience. We are so honored to have you here. So please let's use the clapping emoji to welcome our guest, Dr. Gani. And yes, again, we want to introduce our very key guest speaker all the way from the Veterinary Council of Nigeria. He's a registrar. I mean, we have leaders here. We have top leaders in different spheres of this veterinary profession. So they have a lot of package for us. So I'm sure you're excited. And please invite your friends, invite your colleagues, tell them to join. They can't miss out on this one. Yes, and so I would love to invite introduce Dr. Oladotun Fadipe Ebenezer. Just last week, I think I saw him at my induction ceremony. It was amazing, like great. And now I'm getting to moderate a session with him as a guest. That's so much. Yes. And so Dr. Fadipe is a veterinarian. He bagged his veterinary degree from the ABU, Ahmadu Bello University, Zaria. So ABU alumni, ABU students here. We have an alumnus with us. He is currently the registrar of the Veterinary Council of Nigeria, one of the leading bodies of the veterinary profession here in Nigeria. He has numerous experiences, and he has veterinary clinics in Kwara, Abuja, and Kaduna states before crossing the border to become an administrator in the Federal Civil Service. He got employed at the Veterinary Council of Nigeria as Assistant Registrar in 2010, rising through the ranks to become Acting Registrar in 2023. And he serves as the Chief Administration Officer as well as Secretary to the board. He's also involved in maintenance of the Veterinary Registrar and induction of veterinary graduates from all 11 fully accredited veterinary schools in Nigeria. Like I mentioned earlier, he did my induction into the veterinary profession. So let's welcome Dr. Fadipe. It's so nice to have you here, sir. It's so nice to have all of our guests here. We are so excited and we are so eager to learn from you, to learn from your experience in leadership, because believe it or not, leadership is a very key role in the improvement of the veterinary profession. And across Africa, there is a need for collaboration. So thank you so much, our lovely guests. Thank you for joining. And also our audience, thank you for being here. And also, don't be stingy. Invite your friends so that we can share this experience together. So I would love to hand over to Dr. Abiodun now.
Yes, thank you so much, Dr. Ayodele. I'm already excited, and I'm sure that everyone who just listened to the introduction of our guest is already salivating for the kind of knowledge, the kind of insights that we'll be enjoying this evening. So, without much ado, I would welcome Dr. Nandi Ndudane for our keynote speech. Dr. Nandifa, you have the floor now. Thank you.
Thank you, Dr. Abi. Good morning, good afternoon, good evening, because we're global. I'm not sure the time, but here in South Africa, we are early evening. So good day so that I don't miss whatever time you are in. And thank you so much for Konekt for arranging this connection today. My voice is a bit on it. I've been running a workshop, facilitating a workshop for the past 3 days. So please pardon the voice. Thank you to the panelists, my fellow panelists, Dr. Fadipe and Dr. Gani. I've met Dr. Gani before. I'm looking forward to meeting Dr. Fadipe. And yes, I've met Dr. Titi, and she's a very lovely woman. And I'm also looking forward to meeting Dr. Abiodun and colleagues. It is really an honor for me to be part of this event and part of this evening under the theme Leadership and Collaboration in Veterinary Medicine and Shaping Africa's Animal Health Systems for Tomorrow. Coincidentally, the workshop we've been running over the past 3 days with the World Veterinary Association as the counselor representing Africa, we're actually talking about collaboration and strengthening relationship between the para-veterinarian associations and the veterinary associations in South Africa. So it is really a theme that I am passionate about. The theme resonates deeply with me, and I believe leadership without collaboration is leadership without action. So for me, I was very excited to be given this topic and to understand the challenges that face the animal health, whether it's food security, disease prevention and control, animal welfare, or rural livelihoods. Those cannot be attended to if we are not collaborating and if we are not working together as a team, whether nationally, continentally, and globally. So coming to my leadership, I'm going to start in South Africa. I am the immediate past president of the South African Veterinary Council. My term ended on the 31st of July. I've been in the council for full 2 terms, but I was the president on the last term. So I've learned a lot in the council. I've seen firsthand how strategic leadership can strengthen our profession and our systems. I'm going to highlight a few key areas of my involvement with the council. Firstly, the veterinarians, for some reason, were taken out of the critical skills list, and as the council working together with the South African Veterinary Association, we had to lobby and advocate for them to be brought back into the list of critical skills because it was necessary, because with them being on the list, we were able to attract international and foreign veterinarians to come and work into South Africa. It became easy, but once they were taken out, we had a shortage in South Africa, but we now could not also attract the workforce from outside. So we achieved that through working together and collaborating with a veterinary association. So already that showed that teamwork brings positive results, and positive results strengthen the veterinary council, they strengthen the veterinary profession in South Africa. Secondly, we have been working as the council with the universities that seek to open a second veterinary faculty in South Africa. Historically in South Africa, we used to have 2 veterinary faculties, the Medical University of Southern Africa, which I graduated from, which closed down and amalgamated with the University of Pretoria. Currently, we're only having 1 faculty under the University of Pretoria. So due to this issue of critical skills and the criticalness of the vets, we're looking at other ways. And as the South African Veterinary Council, we took that as one of our strategic flagship to say we will support and endorse institutions that wish to open the faculty. So we have been approached when I was in the council by the University of Fort Hare, we're approached by University of Free State, and we're approached by UNISA, and we supported and visited those 3 institutions in order to assist in how they must approach their application to the Department of Higher Education and Training, as well as to the council. That was us again as leadership indicating that working together, we are a regulator, of course, but we must assist the institutions that wants to come in to understand our standards, to understand what is it that we do as the council and why we do it and why we have to regulate them, so that when they come in, they are able to understand and ensure that they maintain the level of standards that we wish to see in the profession. Now coming to the continental and the global collaboration, because leadership at home must also be meshed with strides across borders. I've already indicated in a roundabout way that I'm part of the World Veterinary Association representing Africa. So I'm representing you guys and I'm representing you there. And I've also worked with the World Organization for Animal Health, where I led a team that was developing competency and curriculum guidelines for community animal health workers, which were published last year. And that was my first international work. And then I joined the World Veterinary Association. And I've just been to Zambia on a World Organization OIE veterinary curriculum review for the paraprofessionals, and this was my first mission abroad. And I'm telling you, it's exciting to work towards a unified vision where we want the paravets to be strengthened and where we want to ensure that we have standardized and harmonized our education. So for me, again, it shows collaboration, because in there we called in the Zambian Department of Education, we called in an equivalent of SAQA, the Zambian Quality Assurance, and we called in the institutions that were offering the paraveterinary qualifications. And we sat together and we looked at the curriculum and we teased out the strengths of the curriculum and we identified the weaknesses. And we've already submitted our report where we have indicated that a second mission now, because that was in review, where we now go and develop a harmonized curriculum for Zambia. And I'm really looking forward to being part of that. Coming back to the counselor for the World Veterinary Association representing Africa, I carry the responsibility of ensuring that the Africa's voice is heard in the global veterinary policy and education debate. I sit in the working group, animal welfare working group, veterinary education and profession working group, and also in the strategy committee. So by being there, I make sure that our voice, our needs are not diluted, because Africa has different needs to the Europe and the Americas. So by being there, I ensure that we are part of the global conversation and we shape them going forward. Hence, this workshop that was held in South Africa. This workshop, I think it was held in Nigeria and it was held in Uganda, but I was part of the facilitators that were running the one in South Africa. Again, as part of the WVA Animal Welfare Working Group, I have deepened my involvement in the animal welfare and ethics, because it's another area that as veterinarians we need to really show and impact the landscape that is changing, because new policies are coming into the fore. This week again in South Africa, there was a 2-day workshop on South Africa's animal protection bill that was being drafted. I'm part of that team, and I have been to Cameroon, attending the 9th Africa Animal Welfare Conference, and There I was tasked to speak on the value of Veterinary Training Institute and the value that they can contribute and ensure that the curriculums are aligned to animal welfare and highlight the issues of replacement, reduction, and refinement. This important conversation was supported by Humane World for Animals, and again, this reflects our shared responsibility to balance scientific advancement with ethical stewardship and to collaborate with the right people and the right organization. I'm looking ahead. I will continue this journey of my animal welfare involvement. I am identified to attend an animal care expo in US in Pittsburgh in April 2026, where I will engage with global partners on advancing animal welfare practices. So collaboration, what does it mean? Collaboration means breaking down barriers. It means respecting each other, understanding our values, and talking with each other, not across each other. As in the South African Veterinary Council, we signed the first African reciprocity with the Namibian Veterinary Council. It was the first time as SAVC we had reciprocity with the Royal Veterinary College of Surgeons and with New Zealand. But we've never had any in the Africa, and I was very excited that I was part of this history. We've signed that agreement and we've visited the two institutions in Namibia, and already UNISA, when they were looking into opening a second veterinary faculty in South Africa, they have traveled to Namibia because as SAVC, we gave them the information that they can talk to our counterparts in Namibia because we want to see this mobility across the borders. It shows that Africa can lead in creating frameworks that allows veterinarians to work seamlessly across the continent, strengthening regional integration and solidarity. I am very big in promoting education, both the veterinary education and the para-veterinary education. I am part of the leadership at the college where I am at, where we offer a qualification of animal health technicians, which is one of the VPPs. In South Africa, we have 5 veterinary para-profession qualification, and the animal health technician is one of the 5 VPP qualifications that are under the auspices of the South African Veterinary Council. I remain deeply committed to advance veterinary education, assist in looking for funding for students, whether they are at the University of Pretoria or they are at Solo, where I am at. I get calls and I get from people that I do not know that my child needs funding, and I'm able to contact most funders and advocate for the students, because as I indicated, we need to advocate and make sure that people are aware of this profession and they get to meet us, because for them to know this profession, they need to meet us as a representative of this profession. Yes, and in closing, colleagues, if we are to shape Africa's animal health systems for tomorrow, we must invest in the people, we must strengthen the institutions, and we must build bridges across borders. Leadership is about vision. Collaboration is about action, and together, these two, they form the foundation of sustainable animal health systems that not only protect animals, but they also protect the people, the communities, and the environment. Let us continue, therefore, to lead with courage, collaborate with a purpose, and to build a future where veterinary medicine safeguards Africa's prosperity, resilience, and well-being. I end with a quote that I've recently seen that says, when you lead and live authentically, when you put in the work from a place of passion and purpose, everything else follows that, because you're having passion and you're authentic and you are inclusive. And it is then easy to translate your vision and have people follow and buy into the vision. I thank you very much.
Wow. Wow, wow, wow. That was a very powerful keynote speech. from Dr. Nandi. So much to take in. So much to take in. Dr. Gani already highlighted one of the powerful statements Dr. Nandi just made. Collaboration means breaking down borders. Wow. Thank you so much, Dr. Nandi. My note is filled. I'm even still typing from the things you've said. Thank you so
Yeah.
much for that powerful keynote speech. I'm sure that we are excited already for what is to come out from our panelists. Dr. Titi, I'm sure you're ready to bring out super insights from our panelists. Please confirm if you can hear me. Dr.
Yes,
Ayodele.
yes, I can hear you. I can hear you very
All
well.
right.
I'm still I'm still trying
What
to
did you think
soak in,
about
the intro.
that
It's
was more
it's a
than
lot.
a keynote speech. Thank you so much,
Yes.
Dr. Nandi. I mean, I don't think we can recover from that pretty soon. And that's very motivational, especially for new vets like Dr. Ayodele. So you're not expected to think within Nigeria. You're expected to think, far beyond and embrace the culture of collaboration. Thank you so much. So, Dr. Ayodele, who would you like to start with so we can kick off the panelist section for the next 1 hour? Then we can have our
Oh,
audience contribute.
right. So we are moving quickly to the panelist session. It's about to get much more exciting. And yes, we'd love to say we should give honor to our fathers. I'd love to start with our father in the house, my grandfather in the profession. Yes, so let's just start with Dr. Gani. Dr. Gani, please confirm if you can hear me.
I can very clearly hear you. How are you?
I'm doing very fine, Sight. It's a pleasure to have you here. Thank you, sir.
You.
Yes. So, Dr. Gani, I would quickly have to start with the first question here. That is, as a current council member, how do you see the role of regulatory bodies evolving in shaping efficient and inclusive animal health system in Nigeria and Africa at large?
Well, let me thank Vet Konect, and I'm one of Vet Konect myself. I'm very proud to be associated with them. They've been doing a lot of great things in Africa, developing apps and bringing up subject matters of interest that require that the veterinary profession must grow. So I feel very proud relating with you. I'm also very happy sharing this platform with Nandi. Nandi, how are you? Um, Nandi is the current Chancellor for Africa in the World Veterinary Association. I think we should need to emphasize that very well. I was also Chancellor for Africa in the World Veterinary Association. So it's good that we are together on a panel discussion. Then Dotun is our registrar, very amiable and intelligent person. So I'm proud to be in the same panel with the two of you. Now, it's good to start by knowing the roles of regulatory bodies in the veterinary profession, because I realize from experience that quite a number of us don't understand the difference between the Veterinary Association and then the Veterinary Council in a way. So I will just quickly run through what the veterinary regulatory bodies are supposed to be doing. They are to determine the standards of knowledge and the skills to be attained by persons that wants to be veterinary surgeons. And of course, veterinary paraprofessionals now, which is the new thinking, and of raising those standards every time they like, based on the circumstances that we find ourselves. The Veterinary Council also register and regulate veterinary practice and veterinary practicing premises. I was the chairman of the veterinary practicing premises for the Veterinary Council recently, and I know that a lot needs to be done in this regard, especially because of the conflicting opinions of the Pharmacy Council of Nigeria, who thinks that drugs belong to them. Well, the Veterinary Council also prepare and review from time to time the code of conduct and the professional ethics that guides our activities as veterinary surgeons. And these can be, of course, changed at any time, improved upon, depending on the practice level of the country. And essentially, the Veterinary Council also maintain discipline in the veterinary profession because they have a tribunal. They have the capacity to investigate cases that are reported to them. So the discipline lies in the hands of the Veterinary Council. And they also have the function of developing the veterinary medicinal product formulary, that is the drug table, so to speak, of the kind of drugs that should exist in a country and how they should be used. And they also grant licenses to veterinarians that are trained abroad. So basically, those are the functions of the Veterinary Council or the Veterinary Board, depending on which the country is using. So having known these differences, now, like the question you want to know is how that would affect the animal health system in the country and in Africa as well. First, we need to jump out of the, I don't like using the word jump out of the box because who put you in the box in the first place? We need to, just like Nandi said, that collaboration is, just like I put it on the chart, you know, we need to begin to look beyond our space. In other words, our country. For instance, in West Africa, our sub-region, we have so many countries who don't even have veterinarians practicing in their country. Sierra Leone, for instance, have just about 2 veterinarians that are indigenous to them. Liberia has about 6. And we have thousands of veterinarians in Nigeria. We can't do a lot of animal health intensification or activities within Nigeria and allow the flanks to be exposed. So what kind of animal health are we going to render here? So collaboration and integration and cooperation is actually the operative words now. Otherwise, the diseases don't have borders. Diseases don't have borders. The animal population that we claim, the livestock population we claim to have in Nigeria, are not just animals that are indigenous to us. The animals who roam around, who come all the way from very far countries, and they come to us as part of what we claim to be our population. So as we are looking at animal health activities and Veterinary Council regulatory activities in Nigeria, we must at this time begin to extend the net to see what happens elsewhere and assist them or join them in upgrading whatever they have that foreign veterinarians are developing for them using temperate experiences instead of the tropic experiences where we live in. So I think that's just the first shot I want to give. I don't know if the follow-up questions will relate to this so that I can allow other questions to come on board. But that's my my initial shot here.
Thank you very much, sir. That's a very nice response, very eye-opening, and I really love that caption. Diseases do not have borders. They don't even require a visa. They don't need a passport, and so they move around. And it's so nice, sir, that you are emphasizing on collaboration and for young vets, even veterinarians, older vets, veterinary professionals, even students. This is very nice, and so we are so grateful. And I'm so excited because I'm sure that this session is fully packed. So I'll be handing over to Dr. Abiodun.
Thank you so much, Dr. Gani. The role, like you said, of the regulatory bodies cannot be overemphasized. Thank you for clearing, the duties of the regulatory bodies separately from the duties of the Veterinary Council of Nigeria. I mean, talking about the collaboration is still showing us that there's still a need for inclusivity where we have all the bodies working together and evolving, to ensure that the animal health system is efficient. Thank you so much for emphasizing on the collaboration factor more. So I would want to ask the next question to Dr. Fadipe Oladotun. It's a panelist section, so if there is any of our panelists that would love to contribute to the question posed or asked to any of the panelists, please, you can also contribute so that we can have a robust conversation. So to Dr. Oladotun, please confirm if you can hear me, sir. Dr. Fadipe. Dr. Fadipe. You are muted if you are speaking, sir.
Hello.
Yes, sir. We can hear you now.
Sorry, the network actually threw me out before. So can you please repeat yourself? Let me catch.
Yes, sir. Yes, sir. Our question to you, sir, that congratulations once again being the new registrar of the Veterinary Council of Nigeria.
Yes.
My question will be in two parts. One, do you think that our Veterinary Council in Nigeria is currently positioned Yes, sir. That do you think our current Veterinary Council is positioned in line with global veterinary standards? That's the part one of my question. And the part two is that what is your own vision for positioning it or repositioning our council with in line with the global veterinary standards?
Okay. Thank you very much. So sorry. I came to Abeokuta for induction, and
no problem,
I'm on transit, so that's why you can see as if you are hearing some interference. Apologies. But back to your question.
Yes, sir.
The Veterinary Council of Nigeria has come of age. I still told them at the induction today that we are the oldest regulatory body in the country, and quite a lot has been put in place to ensure that we compare at par with other regulatory bodies across the continent. I can say it categorically clear that the future of the regulatory bodies is digitization. And that's one of the things that has been aggressively embarked upon by the Veterinary Council of Nigeria to ensure that we are digitized in such a way that anybody across the world can easily get to know what we are doing at whatever time. So a lot of effort is ongoing to ensure that is put in place. I know there are issues, delays here and there because of some policies within the government setting. But I want to assure you that a lot has gone in, and it's just a little more effort for us to get to where we actually want to get to. When it comes to putting the Veterinary Council as a global best practice council, one of the things I know that we have started to do is to start a process of what they call reciprocity, meaning that we want to see how other regulatory bodies across the continent operate. And so that when we have this reciprocity, we can effectively practice across the continent without any barrier. So that issue of reciprocity was started. We have started it in collaboration with the South African Veterinary Council, and I know we are going to keep at it until the process is achieved. For us, being the giant of Africa, I've gone around and I've discovered that quite a number of countries lack, the manpower of what it takes in the veterinary profession. And so we are trying to see how manpower within veterinary, within the country can also be extended to these African and West African countries to ensure, that we actually lend a helping hand, and collaborate. One word that I know is in the front burner with us as Veterinary Council is what we call collaboration. It's a system to see how we can collaborate to get the best out of the system. So I think I will just stop here, and then if we have further questions, I will be able to make more contribution. Thank you very much.
Yes, thank you so much, sir. Thank you. We've heard from the Registrar Veterinary Council of Nigeria that the Veterinary Council of Nigeria is in line with the global veterinary standards, and the new goal is digitization, where we can make collaboration even more possible across and beyond borders. Thank you very much, Dr. Fadipe. I would leave our queens to to the next section now, Dr. Ayodele and Dr. Nandi.
Thank you so much, Dr. Fadipe, for that really insightful note. I mean, the world is a global space now. Thank you so much, sir. So quickly, I would be moving to Dr. Nadipe. Ma'am, I'd love to ask you this very wonderful question, because I think in everything, if it's all your leadership experiences, there will be times that you face some challenges. And so I would say, what are the challenges you faced balancing the professional ethics, the economic realities, like the inflation that is happening everywhere, and public health needs? What are few challenges that you would love to highlight and share with us? And how were you able to navigate through these challenges and still emerge successful?
Thank you, Dr. Titi. The first challenge whilst I was with the council was balancing the needs of the diverse councillors, because we, as I've indicated, we have the veterinarians and we have 5 paraprofessional professions. So already there are diverse needs, and we had to unify and have a common vision. But we were united by the bigger picture that we are looking to ensure South Africa is economically viable, the livestock owners are productive, and the public is protected, and the animals are protected. So that was our vision that unified us together, despite our differences and despite the different professions and the needs, because for instance, the veterinarians are the most matured professions because we've been there forever. The other professions are still new, and they've just been incorporated into the veterinary statutory body. So they are still working baby steps, but we had to make sure that we do not leave them behind when we're discussing things, and we had to make them feel seen and heard, because there was an issue that most things by the SAVC are mainly focusing on veterinarians. So during my time, I had to make sure that the agenda is always having all the professions across the 5 para-professions and the veterinarians. For example, the issue of the ethical animal welfare that I'm talking about, we we're recently engaging with the sector, the NGOs on the animal welfare. SAVC approved that we must promulgate a new profession of animal welfare assistance. And we were busy before the end of our term with that, but I believe that the next council and administration are continuing with that. But we had to call the animal welfare organizations in one room and discuss what is it that they need and where do they think this qualification will be best situated, which university. Currently, the animal welfare certificate is being offered by UNISA, and UNISA was also called onto that platform to say, are you interested to take this further and develop it into a full qualification instead of a certificate? So that is balancing all this. And remember, in South Africa, the Animal Welfare Act is mainly favoring the National SPCA, Society for Preventative SPCA. You know, when you know something, but now you forget. Okay, but it's to do with the animal welfare, but the other organizations are not having a regulation. So even that, we have to bring everyone on board to say, we are not looking and seeking to take the role of the NSPCA, but as the regulator, we wish to have everyone in one room, and so that once we develop this qualification, we do not miss anything because we did not call everybody into the room. I think that is the challenge that we're facing. But again, as a regulator, we are sometimes also told that that is the space of biosecurity is not our space. And yet when we're at the portfolio committee will be asking us, what are you doing with the outbreaks of diseases? What are you doing with the shortage of veterinarians? Why are you not assisting that there's a new faculty? So as a regulator, we also had to then change and then say, we are not going to be wearing blinkers and only focus on the regulations. We're going to look holistically on issues that affect the professions and the para-professions, and we get in there, but we identify our role. What is it that we did? Maybe we start a conversation, or we call people together to collaborate, or we assist wherever we needed to assist, such that during our term, we adopted the term that we were a caring council, because there was nothing that we did not involve ourselves in, but we were mindful that first and foremost, we are a regulator. Thank you.
Thank you so much, Dr. Nadita. That is really, really nice. And seeing how you were able to navigate through the challenge of unifying everybody, and then seeing that everyone's voice is heard, and it doesn't look like, oh, this role is overshadowing the other. It's a very, very amazing approach. And that boils down to the topic today on collaboration. Like, it's so nice to see that you were able to collaborate effectively with these bodies and still emphasize like the distinct role of the regulatory body. So thank you so much for your response, ma'am. I will be handing over to Dr. Abiodun.
Yes, thank you, Dr. Nandi. Thank you, Dr. Titi. You know, what Dr. Nandi mentioned last about biosecurity, it's very. I'm more interested in that because I mean, yes, the veterinary profession plays a very central role in biosecurity, even though, as Dr. Nandi said, it often works in collaboration with other sectors, especially the public health, you know, the agriculture, the environmental management. But I think that we still have the core responsibility as veterinarians. We should be primarily responsible for animal health and biosecurity, because I mean, we are a key part of it. It basically involves preventing, controlling, and eradicating diseases. That's why it is it is biologicals, and you know, especially when they affect living things, they affect animals, they affect humans. I mean, that's where we talk about zoonosis, the environment. So I think even at the national level, as Dr. Nandi rightly said, through veterinary councils, through maybe ministries of agriculture, as we have it in different African countries. Veterinarians are to contribute to national biosecurity policies. We are expected to contribute to early warning systems, outbreak response, because when it comes to it, I remember there was, a controversial issue that happened then. I think it was Ebola when it came to Nigeria. I can't remember the exact zoonotic disease then, that there was almost a clash between the both professions. It shouldn't be, it shouldn't be. Even at the World Organization for Animal Health, it is recognized that veterinarians are the frontline actors when it comes to global biosecurities and One Health implementation. But as Dr. Nandi has told us this evening, um, even though biosecurity is multidisciplinary, the veterinary profession is definitely a key leader and a custodian of it. Thank you so much, Dr. Nandi, for that. Everything still boils down to collaboration. Thank you for telling us how you manage that as a leader in the veterinary space. I would go to Dr. Gani now. Sir, please permit me to call you Dad. Sir, I hope you can hear me, sir.
Yes, I can.
All right, sir. Yes.
Yes.
So, sir, there is a very delicate topic I want you to speak on now. It's quite controversial, and since we are talking about collaboration, and we have them here with us. I'm talking about the veterinary paraprofessionals. We understand that there was an integration of the veterinary paraprofessionals into the veterinary council, and I just want to ask, and so that we can have a direct insight from you, that what balance can we strike between maintaining the standards of each of these, should I call it, each of these professions? I mean, the veterinarians and the veterinary paraprofessionals. What balance can we strike between them and the standards they are supposed to uphold, relating it to expanding the workforce capacity? I mean, how do we ensure that the standard for each of the profession is being upheld globally as we are expanding, the workforce capacity by including the veterinary paraprofessionals into the main veterinary workforce?
Well, the subject of the veterinary paraprofessional, like you said, is sensitive, but we definitely cannot run away from it. They are the soldiers we have on the field. The veterinary health team is all-encompassing. A long tree with the veterinarian as the head of the team, where we have the veterinary paraprofessionals, both the technologists and the technicians. And in some places, they have the veterinary nurses. I think that's what they have in South Africa. And then we have even up to the level of the cleaners, the messengers in our offices. They are part of our veterinary health team. So we need to be able to realize this organogram and know that we as veterinarians can never have enough population to do all of these jobs. Even if we have the numbers, we certainly should not encroach into certain areas that belong to those of other team workers who are supposed to be our assistants. Now, the issue of balancing and then standard is what should be of concern. In Nigeria, for instance, we have left the veterinary paraprofessionals for too long to be on their own. We didn't father them. We didn't own them. That is our fault, because we trained them and then we allowed them to jump out of our control. And then we, at a point, started thinking of them as quacks. And that is not a fair way to treat veterinary paraprofessionals.
Yes,
I don't know
sir.
if you're hearing me well, because there's
Yes, sir.
heavy day
Yes,
here.
sir.
Okay. So I think what we are beginning to know now which is the best global best practice, is that the World Organization of Animal Health has created what they refer to as competency framework for the veterinary paraprofessionals. That's the starting point. We have it for the veterinarians. We have competency framework for ourselves by the World Organization of Animal Health. Now we have it for the veterinary paraprofessionals, and every country has been encouraged to domesticate it in their countries. There are 16 competency that the veterinary paraprofessionals are supposed to be trained in. So what we did in Nigeria, through the Food and Agriculture Organization, and incidentally, I was very key part of this, has been to assemble all the stakeholders in the animal health team in Nigeria, and we now have a competency framework for veterinary paraprofessionals in Nigeria. And of the 16 that the World Organization of Animal Health suggested, because it's always like a global suggestion, we narrowed our own down to 12. 12 areas that we believe, based on our training of the VDPs, that they should be able to operate with their competencies. That recognition is good. Once we bring them into the team, now they were beginning to have a very robust intention to create a council for themselves. And of course, the World Organization of Animal Health did not allow or expect any country to have 2 regulatory bodies. So at the level of the presidency, because they were able to weather their storm, they passed through the National Assembly, and they got their bill ready for the president to assent to before it got to us. And then, of course, we did not allow it to fly. So now what we have done is to have an amendment to the Veterinary Surgeons Act, which regulates veterinarians. And the key things there is to first of all change that the name of the act to Veterinary Surgeons and Veterinary Paraprofessionals Act. We have it in Kenya. I believe we have it in South Africa as well. We have it in Tanzania. That is the global practice now, so that we accommodate all of them. In fact, up till yesterday, we were in Kaduna for a review of the insertions, the amendments we are proposing to the National Assembly. We brought in their members, the president, the secretary, and 2 other members from the veterinary paraprofessionals that are active in Nigeria, the National Animal Husbandry and Health Technologists. They were there with us in Kaduna for 4 days. And it was like a stakeholder validation of the amendments we are proposing into the new law that will accommodate them. Now, if we get this done, it is to our advantage. We are just less than 12,000 veterinarians registered in Nigeria today, but they are more than 25,000, 30,000. And they have the last mile reach. They are the one who goes into the bush. They are the one who works in the communities. And that is how we should promote the activities. So that when the veterinarians are not able to go to those last miles, we need these food soldiers. They are supposed to be our food soldiers to actually carry the animal health message to that last mile, because that is actually where those activities are taking place. So the standard has to be determined by us through the training, the practicals they have, and then through that exposure and recognition that they are not quacks. We only have to define for them the limits, and that's what part of the laws we are putting in place now and the regulations in the council. We need to define their limits to them. In actual fact, in the global thinking, there is the concept of community animal health workers now being given recognition. The World Organization of Animal Health, for now, as at late last year, they have developed a competency framework also for the community animal health workers. They are part of the team. They are not as educated as the veterinary paraprofessionals, but they have a role. We are talking of security implications of even administering the veterinary services to those who are supposed to be our collaborators owning animals. I'm not going to go into the bush now to look for animals, but these community animal health workers, they are able to break through those barriers and go into actual practice anyway on the field under our supervision, under our remote supervision. And that's part of the things, technology, just like the registrar said, the future of the veterinary services in Africa and in the world is digitization and technology. So the issue of standard is right, but you cannot be out of the kitchen and also be on the menu at the same time. So they have to be with us. We have to define for them. We have to identify areas for which they need to operate and own their processes. And that is the way to do it. So let me believe that in the next few years, as we are going on now, the Veterinary Council has already opened a segment of our registration portal that will be able to accommodate the veterinary paraprofessionals. The Food and Agriculture Organization is supporting very robustly in this direction, planning to assist with funding to digitize and accommodate a separate registration for the veterinary paraprofessionals. Then we can have them go through our design CPD programs, post-graduation. We can now make very efficient inputs into their training curriculums, because as it is now, they belong to the National Board of Technical Education. But we are saying that even if they are having the curriculum administered by the MBTE, they have to seek licensing from the Veterinary Council of Nigeria, which means we must monitor whatever they are doing and also recognize them in those 12 different areas of competencies that the World Organization of Animal Health has approved for us in Nigeria. And this we have to extend. We're also thinking that, like we said, collaboration. We can't do this alone in Nigeria and allow our flanks, the countries around us, to be aloof. No, we also have to think of how to extend whatever we are doing here to capture the capacities and the strategies they have in all of those countries that surround us. So that is the approach that the Veterinary Council is adopting today.
Wow, thank you so much. That was very, 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 very profound. Thank you so much, sir. Just a follow-up question before Dr. Ayodele asks Dr. Fadipe his question. Sir, you mentioned that I think Sierra Leone has just 2 indigenous veterinarians. Is there a way that, as we are training, the veterinarians in Nigeria or other African countries to be of global standards that they can practice anywhere, is there a way that we can incorporate the veterinary paraprofessionals? I mean, you just emphasize the fact that they are our foot soldiers. Probably they can be of more relevance to other African countries that are of shortage, that are short of veterinarians, like Sierra Leone.
But apart from the veterinary paraprofessionals exportation, so to say, we are also encouraging the veterinarians from Nigeria should begin to make inroads into those West African countries for a start.
Yes, sir.
When we need a lot of, for now, they are relying on France. Most of the veterinary services in these other countries are managed by consultants from France, who, like I said, they only had to retrain themselves through CPDs in tropical diseases. They were not trained primarily in tropical diseases. They are from the temperate, and then the syllabus they trained with is certainly not the same with the syllabus we are using here. So
Yes,
we
sir.
need to begin to
Yes, sir.
consciously make inroads into these countries. When I was president of NVMA, one of the very strong things I did was to approach the Ministry of External Affairs. So that's what it's called there, not Foreign Affairs. And then they have this Technical Aid Corps program, TAC. And when I had an opportunity that the deputy director of that program was a senior to me in secondary school, and I was coordinating the association in West African countries at that time. So I had the database of all the veterinarians in all the countries in West Africa at that time, which is all, see what it's looking like today, almost 12 years ago. And I was able to convince the Technical Aid Corps to allow Nigerian veterinarians to participate in their scheme. And they gave us 50 slots out of the 1,000 slots for 2012, 2013. And out of the 50 slots, after interview, 38 veterinarians from Nigeria were enlisted in that program for that year. I can tell you that many of them didn't come back home because they had niches they needed to fill. That opportunity is still there. I mean, I'm sure the Veterinary Association, NVMA, is also still putting it as part of their activity plans. You know, we can start with that. But I also know that even today, some Nigerian veterinary companies like Pharmalat have extended their services to Liberia, and they have been very much welcome. So we need to begin to look beyond our shores for the delivery of our veterinary services. Just like I said, because whether we like it or not, the best, no matter how best practice we put in place here, if you leave our flanks open, diseases don't have visa according to Titi. They won't need visa to cross from one country to another. There are no boundaries for them. So we need to definitely, either through governmental support or individual intentions, move across our borders. The jobs are there. The veterinary paraprofessionals, some of them are already moving out. Like I said, they are not even licensed by us, even though we are beginning to do that now. They are moving, and they are seeing the jobs, and they are seeing the money as well. So I think the future is in this itinerant attitude and migrations. We don't need to go to Europe and America. If we really want to work as veterinarians, we have the jobs here in our region and in Africa. If we have that deliberate intention to really do the veterinary services. That's the way it goes.
Yes, sir. Deliberate intention to do the services. Thank you so much, Dr. Gani. I'm still coming back to you, sir. Let me allow Dr. Titi ask Dr. Fadipe his question.
Yes, sir. Thank you so much for that. See, deliberate attention. Okay, so Dr. Fadipe, I would love to ask you this question. Like you said earlier, the future of the regulatory body is digitalization. And so, sir, how can the VCN partner more actively with continental councils, universities, and technology innovators to build a harmonized African veterinary system?
Okay, thank you very much, my sister. And yes, hello.
Yes, I can hear you very well, sir.
Okay, thank you very much, my sister, for that question. And I want to appreciate all the previous speakers for an excellent job in answering all the questions that have been posed. Now, like I said earlier on, collaboration is the way to go. An African adage says, if you want to go far, you can go alone. But if you want to go fast, sorry, you can go alone. But if you want to go very far, you need to go together. And the Veterinary Council of Nigeria over the years have looked in that direction to see that we cannot go alone and succeed. And as such, what Dr. Gani have said, we felt we needed to onboard the veterinary professionals so that everybody that is a key stakeholder in the animal health sector is brought together. You know, when we all come together and we collaborate together, we'll be able to form a formidable team to achieve our goal. But beyond that, in our show here in the country, we've also extended an arm of fellowship to other African countries. Like I said earlier on, we have written to the South Africa Veterinary Council, indicating the fact that we want to have collaboration with them on the subject of reciprocity. South African Veterinary Council has that same similar reciprocity with the Royal College, and that has created the leverage for people who finish in South Africa to be able to practice in other places where they have that reciprocity. So we also felt this is the way to go. We don't want to train veterinarians that can only practice within the shores of Nigeria. We want the situation whereby when they are trained, they can practice all over the world. And that process has started, and we are not going to stop until that is achieved. And like you all know, like I said earlier on, we have tried to digitize our process and make ourselves a little bit more visible than what we are before. But beyond that, we're also looking at collaborating outside the shores of Nigeria to ensure that as many as are trained here will be able to practice. Many of us that had finished from Nigeria about to go outside the country and write the exam again before they're allowed to practice. And what gives me joy was the crop of several veterinarians that wrote the Royal College exam last year, or is it early this year or thereabout, and they succeeded. So many of them. And that gave me joy to see that what we are giving our veterinarians in Nigeria is actually qualitative. Of course, you will agree with me that there's always room for improvement. I'm not saying we are giving them the best, but we are actually working towards ensuring that they get the best. And so I'm sure that when this reciprocity starts, because there are so many processes that we need to follow, and we're ready to follow all the processes to the letter to ensure that the right thing is being done. Vets that finish from Nigeria will be able to practice outside the shores of Nigeria confidently without having it to go through rigors of writing the exam and the like. So I think that is what is on the pipeline, and that is the way to go. Thank you very much.
Thank you very much, sir, for that response. I mean, if there's anything I've learned this evening is the emphasis on collaboration. Like it's very, very important, and it's so good to see the efforts of the VCN to improve the veterinary education even outside the shores of Nigeria, and even looking forward to collaborating with other veterinary councils. Thank you so much, sir, for sharing that wonderful insight to us. And permit me to use this word as a Gen Z vet, like that's really on point. So I would love to hand over to Dr. Abiodun.
Yes, thank you very much, Dr. Ayodele, and thank you, Dr. Fadipe. Just for mentioning, I would love to suggest, I mean, as this is being you done collaboration across African countries when it comes to vets, I'm thinking of how we can incorporate it into the veterinary education system. Dr. Gani, when he was speaking, mentioned that, mentioned the gap between trainings. I remember in vet school, in fact, there are some diseases they will tell you, as your lecturer is teaching you, they will tell you might never encounter this in Africa. And so I mean the teachings they are holistic, they are encompassing. So I'm surprised when Dr. Gani said some vets are trained in temperate diseases, why they are not trained in tropical diseases. In Nigerian vet school, we are taught everything, even the one you will not see till you exit this world. I mean, so as we are doing that in the veterinary space, I'm thinking of how we can incorporate it into the veterinary education system for veterinary students to also start these partnerships, these collaborations with other African countries. I know that associations like IVSA provide opportunity for exchanges. For, I mean, if the regulatory bodies can come up with something like a reform or something that can, bring about exchange of information or experiences among veterinary students across Africa. I think that's one collaboration that would really, really work out, so that even beyond writing exams after you become a vet, you must have, gathered experience even while you are a veterinary medical student. I'm going to ask Dr. Nandi, one more question. Then we have one question for the three panelists to answer. Then we open the floor for our audience. They've been patiently waiting to contribute. So, Dr. Nandi, I just suggested one collaborative reform, for the Africa Veterinary Council, if we can come together to do that for veterinary students. So I want to ask you, Ma, if you could recommend one collaborative reform for the African veterinary sector today, what would it be?
If I could recommend one continental reform for the councils. Firstly, I think we must form a community of practice for the VSPs. We started with the Food and Agriculture Organization. Last year we met in Kenya. It was the Kenyan Veterinary Board, the Veterinary Council of Nigeria, SAVC. I'm not sure the other council that was, I think we were 4. We've been trying to set up a community of practice for VSPs so that we are able to harmonize and share knowledge. What has been mentioned here by Dr. Fadipe about the reciprocity, we've been working to assist Nigeria to also achieve reciprocity across. And we've also been working with Kenya to assist them to set up some reciprocity agreements again. So I think if we could form that community of practice for VSP where we'll share knowledge, because as South Africa, we called on the Veterinary Council of Nigeria to assist us with digitalization of the SAVC, because Nigeria is very advanced with issues of digital apps and all that. You've got this good, very impressive app where we are able to identify a vet, the facility, and everything, and there's the vet registered. So with South Africa, we wanted to work with Nigeria, the Veterinary Council of Nigeria, to adopt that and be guided. So there's a lot that if we're together in that community of practice, we can learn from each other, so that we're not always thinking that we're better than. Instead, we're saying collectively together in Africa as VSPs, we are stronger together. If I use the Springboks call of action, they are stronger together. So that is one that I can call. And then the second one, I know you asked for one, I can also call for a Federation of Veterinary Medical Association. We do not have one. And that is the strength of Asia, that's the strength of Europe, and the strength of America. They've got an association for the region, for the continent. So we need to have that association again under WVA, working with Dr. Olatunji, which is from Nigeria, and Dr. Oma, who's from Kenya. We're trying to set that up, and we still need to do that. I think we need young vets, Dr. Titilayo and everyone, to come in and we do that, so that we have that association that is going to unite us together, so that we're able to look at Africa issues as a collective. Thank you.
Wow, thank you so much. Ma, I am open to it. You said you need young vets. I'm open. I'm sure a lot of young vets are open to it. I can also see Dr. Olatunji on call. I'm sure that when it's time to, when we open the floor, I'm very sure that he has some comments to share. Thank you so much for that. Those are two lovely continental reforms that I think we should bring into fusion. It's not just it's not a selfish one. It's one that is encompassing. It's one that is bringing Africa as a continent together, especially as regarding the veterinary space. And I totally support it. I think it's a perfect one for us. It is what we need now. Thank you so much, Dr. Nandi. So before we have the audience come in, we have just one question for the panelists, just one question, and the three of our panelists will answer, then we open the floor for contribution. Dr. Titi.
Okay, thank you very much. Thank you so much, Dr. Nandi, for that really exciting point, rather. And yes, and bringing in young vets. So very exciting. Okay, so we'll be moving to the final question for all our panelists. And this time it is just one question for all three panelists. So we'd love all our three panelists to bring their unique perspective and unique answers to just this one question. And we'd love to start with, would love our father in the house, as I say, my grandfather in this profession, to start with answering that question. So the final question is, looking at Africa, where Africa is today, and where we hope to be in the next decade, what practical things do you think veterinary leaders like the council, associations, the innovators, what practical things do you think they can start doing now to make animal health systems stronger and more prepared for the future?
Thank you, Titi. First, mentoring has to take a very prime place in the curriculum and training of veterinarians. There is a very huge difference between supervision and mentoring. We are not discussing mentoring as part of training in our curriculum today. Then selection methods for admission into the veterinary program has to include tests of motivation. It's not going to be sufficient just for those who fail to qualify for medicine or pharmacy or other courses, making veterinary medicine a second option. And then we now expect them to come out of school and become great practitioners. It's not going to be very likely to happen that way. So the selection process of those, we also need a training system, a training program or curriculum that allows some of us in the private expositions, those in private practice, to come into the university and take up training courses for our students. That is where all of these things will start from. Entrepreneurship is a great course, but not in the way most of us understand it. I'm lucky and happy that even at my age, I've just taken up a PhD course. I've done a year in entrepreneurship and innovation management. The world is changing. We have AI for today. We don't know what is coming tomorrow. So we need to put all of these perspectives into the curriculum of training veterinarians so that when they graduate, their outlook would match the diverse nature of the country and of the world. So it's about curriculum adjustments, about training programs, about training plans, such that every hand will be on the deck. And then we can now begin to have, just like Nandi said, new leaders, young, youthful leaders who should be bold enough to come out and do this and play the politics of the profession and come into the world space. We won't just wait and allow others to take decisions for us. And just like I said, consultants who come into West Africa to render veterinary services from France were not trained in tropical veterinary medicine. They were trained with emphasis on temperate conditions and diseases familiar to them in the temperate regions. They can't come here and do the job in the way that will make it satisfactory. You have to be the ones. So I don't know. I think that's just about what I believe the future holds for us. The changes have to be encouraged, have to be imbibed. The days of allowing people to be in silos in the name of being lecturers who don't believe in a town gown collaboration should be over by now. Even in those we copy the training from, they are changing. The method of examination is changing in the West. Last year, there was, what's it called now? The 5-year Alpha, Zoetis Alpha program was rounding up, and they invited some of us to Uganda. I was there to offer opinions on how the future of the veterinary practice should look like. And what some of us presented was that we don't need to continue with the method of assessment of professionals, of veterinarians, the way we are doing it now, by allowing people to cram books into exam halls just to pass exams, because we realize, in my opinion, the best graduating students don't turn out to be the best professionals on the field. They are not. So that means the assessment is wrong by making them to come out to be the best students, and they cannot deliver the practice on the field. So as a lot of things about training have to change, the question would be to me that I'm a member of the Veterinary Council and we need to start these changes from the Veterinary Council. Yes, we are beginning to take all of these perspectives on board. Thank you.
Thank you very much, sir. That's very awesome. Very, very amazing, sir. Like you say, all hands on deck and the need for innovation. Thank you so much. I'm so glad we are having this session right now, and even so glad that it's also live and it's recorded, and then we can always go through. I mean, if you missed out, maybe your friend missed out, you can always tell them to come back to watch this session because it's great. There's so much knowledge we are learning from the guests. And thank you so much, sir, for sharing your insights. So I would love to move to Dr. Fadipe, sir. So what would your response to this question be, looking at where Africa is today and where we hope to be in the next decade? What practical things do you think the veterinary leaders, like the council, associations, the innovators, what do you think they can start doing to make our animal health system stronger and more prepared for the future?
Okay, thank you very much, moderator. Let me give some riders to what Dr. Gani has said. For me, after going to the veterinary school, one of the things I would love to see is a situation whereby our veterinary schools focus on clinical practice a lot more earlier, meaning that from 500 level, we begin to have almost all through clinical practice. And this clinical practice is such that people will have at the back of their mind what they want to do, and they begin to specialize because, everybody graduates in the same stream. But when you get to 500 level, like in agriculture in ABE, for instance, when they get to either 400 level, for instance, they begin to specialize. Those who want to go to agric economics will go to agric economics. Those who want to go to animal science, a lot of other specialties. So I want to believe that we should be graduating as specialists, focused, not just being thrown into the society, not knowing where to, to turn to. But when you give us opportunity from 500 to okay, what do you want to do? What area do you want to specialize? And then the person say, okay, I want to go into clinical practice. I want to go into equine practice. I want to go into porcine. I want to be an entrepreneur. And then you now tailor the process in the last 2 years to that direction. It helps more in having us, being relevant when we get out rather than just going out without proper direction. And like Dr. Gani said, mentorship and other things are things that are there to be put in place. So I think a lot has to do with our curriculum to train in the training process, and currently there's a lot of complaint about our curriculum. They say it is 16 months or something like that, and good enough, the current ES of the NUC is a veterinarian and he has a listening ear. I'm sure something will be done to see that we have a better curriculum than what we have now, and then we'll be able to train better veterinarians in future. I think the sky is the limit. There's a lot we can do to ensure that we have future leaders that will be relevant in the society. Thank you very much.
Thank you very much for your response, sir. If there's something I'm learning from this right now is the future is the young veterinarians, is the training of the young veterinarians. So the need to improve the curriculum, the need to mentor, the need to guide, and that is really, really insightful. Thank you so much, sir. And so finally, I'll be moving to Dr. Nadi. And ma'am, I would love you to share your own insight to this, looking at where Africa is today and where we hope to be in the next decade. What practical things do you think veterinary leaders, the council, associations, and innovators can start doing to make our animal health system stronger and more prepared for the future?
Thank you, Titi. I think firstly, we need to strengthen governance and collaboration. As I've indicated, that we need to be agile as the councils and associations. We must not only be in blinkers that we are a regulatory function. We need to ensure that we deliver beyond regulations. We are innovative, we are leaders in digital innovation, and we promote partnerships. That's number one. Secondly, we need to inspire the young veterinarians to come into leadership. Therefore, we need to strengthen training and mentorship by introducing skills, entrepreneurship skills, leadership skills, communication skills, so that the young vets, when they come out, they come out ready, confident, and able to come in and lead. For me, those are the two. If we strengthen that, I believe that we can have a future that is very bright for the young veterinarian.
Thank you very much, Ma. That is really, really wonderful. I mean, young veterinarians and young veterinarians to be training veterinary students in the call. I'm sure we are gaining a lot of things here. The need to be innovative, the need to learn, build on communication skills so because the future is really the younger generation. And so thank you so much to our guests. Personally, I've learned a lot from mentorship to training on entrepreneurship, even in the veterinary school, to improving the curriculum, different unique perspective, and even collaboration and coming together to answer this question. It's really wonderful. And I must say that our awesome guests did amazing. Thank you so much, doctors. It's such a pleasure to have you. And I'll be handing over to Dr. Abiodun.
Yes, thank you so much. So we have the next 10-15 minutes to hear from our guests. So just raise your hand and we invite you to speak. Just raise your hand and we invite you to speak. Do we have any hands raised? All right, Mr. Gideon, you have the floor, please.
All right, thank you so much, Dr. Abiodun, and a very big thanks to our guests. It has been a very amazing session with you, and personally, I was so inspired hearing everything that has been shared and has been said so far. I don't know if it's a good time to ask question.
Go ahead, sir.
Yes, all right, thank you. So I want to ask, I don't know what the situation of things is currently, because I heard a couple of things that are going on at the background, and this is not the first time I'll be hearing this. And over time, I've already seen this even captured in the cooperation, or should I say collaboration, that is happening between the World Organization for Animal Health, especially as it has to do with the veterinary paraprofessionals. But then I want to know, to make this thing effective and to make it seamless as possible, what is the situation of things as regards the controversy that exists between NAT? Because this is another problem. Over time, I think there was a time that FCN threw out a form for veterinary paraprofessionals to fill for a training. And over time, there have been a couple of trainings that have been happening targeted towards veterinary paraprofessionals to empower and to help them, get better in what they are doing. But then there is this issue of skepticism, whether to be part of what the FCN is offering veterinary paraprofessionals now, or to just stay with NAT and then turn a side of nonchalance to what is happening from the FCN side. So I want to understand that. I hope that the NAT is being carried along, or should I even ask that, what is the status of things with the controversy that exists between NAT as it has to do with this collaboration of the thing and FCN currently?
All right, I think Dr. Gani or Dr. Fadipe will be able to answer the question well, since it has to do with the council in Nigeria. So any of you sirs can help us answer the question. Thank you.
Well, I actually mentioned it earlier that since Sunday this week, up till yesterday, we were in Kaduna having a final look at the revision of the Veterinary Surgeons Act, which is now being proposed to be Veterinary Surgeons and Veterinary Paraprofessional Act. It's still a bill. It's going to the National Assembly and for presidential assent if all is well. Their president of NAC. Now, let me say that when we say veterinary paraprofessional, it's a very wide, all-encompassing description, not only for NAT. It's just that NAT, that is the National Association of Animal Health and Husbandry Technologists, they are the only organized, let me say, most organized group referred to as veterinary paraprofessionals in Nigeria today. With time, we were told that the University of Ibadan is warming up to start a veterinary nursing degree program. Sorry, degree program, veterinary nursing. I know a lot of other universities will take a cue from that. When they start graduating, there will also be a unit that will be referred to as veterinary paraprofessionals. So that will be an umbrella for all of them who are not veterinarians. So we are already seeing all of this coming. So the status is that changes are taking place. They were part and parcel of the revision of the current law. Throughout the whole of this, we were together with their president, their secretary. They have a lawyer amongst them. Two of them, they came, and they were in different committees, groups within the meeting that we had in the last week. We came back just yesterday. So we are working together to have clear definition of roles and to imbibe them, to own them as part of the veterinary health team. Nandi is here. South Africa has gone successful in respect to this. Kenyans have done the same thing. They have a law that covers as an umbrella veterinarians and the veterinary paraprofessionals. So no matter what friction we are seeing today would ease out with time when the law takes a firm root. Dr. You're the registrar, so I'm sure you need some other flesh to add to this. Thank you.
Okay, thank you very much, Dr. Gani. You know, a father is always a father. And the good news is that you're a member of the board. He has said it all. We had a very, very fruitful meeting with Nat in Kaduna this last time, and they saw reasons with us. Of course, they made their suggestions. They are welcome. Their suggestions were also carried, you know, during the process to ensure inclusivity. So they are being carried along, and a lot is in the pipeline to ensure that they come on board. Where we are now is a season of collaboration, and all of us must join us together to ensure that the right thing is done. So we're on track. We want to do what the global best practice suggests, that they are being regulated by veterinary, a single regulatory body in the country. And that is what is ongoing currently. So I'm sure we're on course, and in due season, everything will be finalized. Thank you very much.
Thank you, sirs. Thank you, Mr. Gideon. All right, Mr. Gideon already acknowledged. All right, sir, Dr. Nasir. our guard is up. Welcome, sir.
Good evening, everyone. Welcome.
Good evening.
Good evening, everyone. Let me say a very big up to my Oga, Dr. Gani Enahoro, and Dr. Toyota and Ndudane from South Africa, my colleague at the World Veterinary Association, and my registrar on this call. I'm happy to note that the paraprofessionals, or maybe the NAT people, have just seen reasons with us. Because I remember that the last meeting we held, maybe around, was in May or June in Abuja, pioneered by the WVA, was very cantankerous. And if you are reporting that they have now settled and are now collaborating, then I'm very, very happy to note this development. But my thing this evening that I really, really, really want to talk about is the outlook of the veterinary profession in Africa. For me, in my assessment of the African veterinary health systems, I think we have not started. One way or the other, we are not doing what we should be doing. The countries in Africa are not ready for collaboration. Perhaps maybe just those who are ready should just go ahead. Because I'm looking at it from the prism of what I know. I was the president of a CBA for 4 years, 2019 to 2023. And I can tell you that with all our evangelism, up to the time I'm speaking to you now, less than 15 African countries in English-speaking African countries are in the CBA. I can also tell you authoritatively that even in the WVA, the World Veterinary Association, we have less than 20. And that one is not language-based. CBA is language-based. This one is everybody, even if you are speaking Spanish or Portuguese or whatever. Less than 20 African countries belong to the WVA. And then we are talking about a continent with one destiny, a continent that should ordinarily have no borders in terms of disease control and everything. Because diseases don't have borders. They can crisscross everywhere. And if we are not all united, you know, in a milieu that has everybody together, how do we extend this issue of collaboration that you guys are talking about? How do we prevent diseases from crossing borders? And we're already seeing it. We're already seeing it. For me, I don't know what the AU is doing, or the AU IBA or whatever. I don't know what they're doing in terms of compelling African countries to join hands with themselves in order to be able to, you know, how do I put it? To allow their citizens to be enjoyed ordinarily. And that is why I'm going to what Nandi said. Because we have realized this. Yes, we know we have an African Veterinary Association. It's not working. Because if we are not in a of an association within Africa, out of all men, I don't know how it sounds to you that it's only Africa that does not have an organization. The one we have is totally moral. And that's why we're trying to say, we just form what we call a Federation of African Medical Associations. And I will tell you that some of us are in the heat of, and like Randy said, it's just for us to get it off the ground. The young ones should and take it over. A lot of us are already getting tired. Some of us are in our late 50s, our early 60s. And people trying to pioneer and midwife this to free. Where are the late 20s? Where are the 30s? We don't see them. I've been attending meetings all over for the past 30, 40 years, it has always been the same faces that I'm seeing. Except this day that I see Titi. Yes, I think I've seen Titi in about 2 or 3 occasions of meetings or something. So what I'm trying to say now is, yes, the question of collaboration, partnership, and whatever should not be lost on us. But then, are we really having a platform to even further this? Do we have the platform to further this? When I am in that, I mean, Nigeria is in CBA, whatever, and then the neighboring countries are not in anything. Where are we going to share things? Even in the World Organization for Animal Health, how many of them come to France for me? I've been there like once or twice. How many African countries come? How many? So they just stuff things down our throat, and then we think, oh, it's a WHO prescription, and that's all we say. But are we there to really say this is our peculiarity in our country, and then try to see how we can work together to make sure that African continent itself, or if you want to do it, maybe regionally, because even among the West African region, we're not even collaborating. Nigeria and Ghana are not collaborating. I know that for sure. We're not. So that is the perspective from which I'm looking at this. I think the young veterinarians should take the gauntlet to see how they can remedy what we have failed, in doing. Although at the end of the day, we are still trying to see how we can bequeath a legacy, as in FAVMA. So I want to stop at this time, but that is my pain. That is my pain. WVA, we have less than 20 members. CVA, we have less than 15 members. In the whole of Africa, there has 54 countries. And then we are talking about collaboration and partnership. With who? Good evening.
Oh, thank you so much, sir. That was a comment from the heart of hearts of Dr. Nasir. Let's have comments on that from our panelists. Then welcome Dr. Shijak, our CEO, for a final note before we. I wish we are not ending this, but let's have comment from our panelists before we welcome Dr. Shijak. Dr. Nandi, you want to go first, Ma?
Yes. Let it come in first. Yeah. I understand Dr. Ola and the impassioned plea. We really do need to collaborate, and we need to commit to collaboration. We must not see each other as competitors. We must actually see each other as when I was doing biology, we talked about symbiotic relationship. There is a greater good in us working together than when we are working individually and against each other. The elections for WVA 2026 councillors have just been opened, and we already are saying Dr. Ola for president-elect, and that is us collaborating, because we are not going to be competing. If we're putting one person, we want to be all coming together and saying we are going to be voting for Dr. Olatunji, and we are assured that he will then be the next president for WVA, and will have a president that is coming from Africa that is representing us. So already that is what we are doing in that platform of WVA, because we are seeing the strength in us working together. So we must put it in action. We must practice it daily, and we really do want the young vets to come on board. Thank you so much for having us in this conversation, and to continue talking about leadership, collaboration, and teamwork.
Thank you. Thank you so much, Dr. Nandi. Dr. Fadipe.
Thank you very much. Like you said, everyone can feel the pulse of Dr. Olatunji Nasir. And like we all know, it's not as if we are there, but we are striving to be there. For me, it is not gloomy. All hope is not lost. The future is very, very bright. Once we rise up as individuals and as veterinarians, and we want to collaborate and join force, I believe it is doable. And I believe in recent times, a lot has been done in this direction to show that we are actually going to go there. I think we need to keep our eye on the goal and work towards it. And definitely we are going to achieve that collaboration that we want to place African veterinarians in the right of place. Thank you very much.
Thank you so much, sir. Dr. Gani?
Yeah, thank you. Tunji has said it all. Is in a position to know. Nandi has said exactly what I wanted to have said, because I think what I would say differently is that we have a mentality problem in Africa. Just like I've said now that the gap, the veterinary services gap exists in a lot of countries in Africa. If a Nigerian goes to look for consultancy and the French man comes with his own CV, chances are that even at a very huge cost, the Frenchman might get the job. So that mentality need to change. That mindset need to change. We have to be, I don't know how the process will look like. Maybe if we are able to carry it through and push Tunji, God helping us, into becoming the next WVA president, that could be a rallying figure, a rallying point. I tried to do it. I contested to be WVA president at a time, and I succeeded in the first run. We were 4, and then we were 6, and then 3 of us crossed over to the second round because nobody had a winning vote. I was one of the 3. And then, of course, the Spanish brother went home, and all the Europeans who voted for me before decided to vote for him, and some Africans even voted for him at the final round. So we need to look inwards and solve our problem from within, first of all. I don't know how the young vets, we need to push you people because it's now your turn. We have taken the profession to a level where we are now tired. But you younger ones need to be bolder than us. Apart from the competencies we display, we must have the confidence to be able to challenge the world. So it's not just competence alone. We must have competence and confidence to look at the world. When I was in the WVA as councillor, I was the chairman of the policy committee for 2 years. And that was where decisions were taken globally for the veterinary profession. So we need boldness to be able to do all of this. So the ball is back to your court as young veterinarians. Not just look for work alone, but take mentoring from some of us and challenge the world with your confidence. Thank you.
I'm motivated tonight. Dr. Titi, are you motivated?
Yes, I am. I am feeling so.
Yeah. Let's welcome our CEO, Dr. Shejak Akpem, for his contribution and his final note and appreciation for our guests and our panelists. Thank you. Welcome, sir.
Thank you so much, Dr. Abiodun. Wow, this is incredibly humbling. Thank you, Dr. Nadi. Thank you so much, Dr. Fadipe. Thank you to my daddy and mentor, Dr. Gani. Listening to every single thing that has transpired here, I'm just asking myself, what do we do next? But like I am always weary of conversations like this. What I always say when I'm in rooms like this is, whether virtually or physically, is that let us not just get pumped up in the moment. I think a lot of conversations, I wish this would be amplified into the ear of every single veterinary professional across the continent, so we understand what is at stake. The world is not waiting for us to catch up. It's moving, and it's incumbent on us as professionals to not only look out for our individual processes. The good thing is that for every single professional that has chaired our panel today, they are well-established and achieved professionals in their own rights, and the records are there to speak for it. They have also shown clearly how far they have gone to also push the profession forward. And in I think Chinua Achebe's book, No Longer at Ease, he asked a very profound question: that where are the young suckers who will take over when the old bananas die? This is a question I'm posing to we young veterinarians. Dr. Nasir has already posed that question. Dr. Gani has also emphasized it. And I would say that we must, at this point, ask ourselves the question to say that if this is indeed a generational struggle, which I believe it is, because for us to be able to catapult the veterinary profession to where it needs to go, we must think in a very futuristic sense. It mustn't be something that what is in it for me. The conversation has gone past that, So we must all bring ourselves together to say that in moving forward, how can we all contribute meaningfully so that we consolidate our efforts, we collaborate together, and seeing what is already happening. Because I follow very closely the work Dr. Gani is doing with the FAO in respect to the veterinary paraprofessionals, seeing the collaborations, and we on our end with the Vet Konekt Champions program, we are seeing for the first time students who are studying to either become veterinary doctors or veterinary paraprofessionals, collaborating on projects right in their undergraduate years. We can only think about what will happen when they eventually graduate. So they are not graduating with the mentality of thinking that they are going to be competing against the vets or vice versa. But they are going out knowing that this is an ecosystem that requires that if we succeed in it, we must be able to collaborate. So I'm excited about what has happened here with all of the points that have come out. We are going to synthesize them. We are going to keep pushing it forward, because if Africa and the continent is going to prosper and succeed, we cannot deny the central role that the veterinarian will play. And that is to speak to say, because what are we in Africa outside of agriculture predominantly? And then how can we not, say we'll not talk about livestock production? And then how can you talk about that without what the animal health professional is going to do at the center of the equation? So I'm truly humbled to have us all participate through this very intense engagement. Thank you to our panelists. Thank you to the team. Thank you, Dr. Abiodun. Really appreciate you coordinating the entire process. Our wonderful moderators. You all did an amazing job. I thoroughly enjoyed myself, and I look forward to listening to the replay and also sharing it so that more colleagues would be able to tap into it. And more importantly, looking forward to the next episode of the Afrivet Chronicles, because indeed, this is the very fundamental reason why this was put together. Let us hear what is happening across the other African countries. And Dr. Nadi put it very clearly when she said that it is about breaking those barriers. We cannot talk about globalization in the context that we're talking about now, when we have so high fences blocking our ability to be able to transcend or even translate our knowledge and expertise. If vets are excelling in the US, in the UK, in Canada, in Asia, why can't a veterinarian in Nigeria take that expertise to South Africa or to Kenya or to Rwanda or to Namibia or any part of Africa for that matter? Because again, we are mostly tropical. So if the realities are about the same, fundamentally down to preventable livestock diseases and lack of access to animal care, how can we say that ourselves will not be able to solve our problem when we want to be able to throw, the resources in the wrong places? So I think this is a fire is brewing here, and if we sustain this tempo, which we will, for me, I always say that I would never be on the sideline in contributing in no matter how small level I can to ensure that we keep pushing our profession forward. And that is the very essence to which Vet Konekt was bettered in the first place. Thank you so much for the opportunity, and over from me and back to you, Dr. Abiodun. Thank you.
Thank you so much, our very own visionary leader, Dr. Shejak. Thank you for also birthing this dream, in which or through which we are enjoying this fantastic discussion. And once again, we want to appreciate our panelists, our leaders, our mentors, our fathers, our mother, Dr. Nandi, Dr. Fadipe, Dr. Gani. Thank you so much. Indeed, it was a very impactful section. I'm motivated. And as Dr. Shejak said, so we don't just get caught up in the moment. We should also, as a result of the motivation we have generated from this section, listen to it again when the link to the recording is out, and make intentional, deliberate decision as Dr. Gani said earlier, so that we can be a partaker of this movement. So it's 7:11 p.m. Here in West African time. I want to appreciate everybody for joining. Thank you so much, Dr. Nasiru, for that deep art contribution. Thank you so much. Thank you, Thank you, Mr. Gideon, for your contribution. For the clarification made by Dr. Gani. Thank you, everybody. We see everyone who has joined. We are also going to reach out to you via mail, and just for understanding sake, I'm sure that almost everybody knows what Vet Konekt is all about. We're a digital animal health platform. What we do is that we are reimagining animal care to connect livestock farmers to veterinarians, and beyond that, we offer value in the form of productivity, in the form of health, and holistically, like what this program is doing, we are changing, positively the animal health system in Africa. So thank you so much. We have a platform to get to know more about us. www.vetconnect. Connect is with the K, vetconnect.com, and also a mobile app on iOS and Apple Store is live. You can also check us out, and if you have any inquiry, you can just reach out to me. I'm sure I'm not a very hard man to find. You can reach out to me for any inquiry about VetConnect. So once again, we are so grateful to our panelists. We are so grateful to every of our audience that have joined this section. Thank you so much. I'm sure that you enjoyed, you got value from this section, and we'll be rest assured that even the next section is going to be much more richer, and I will just keep getting better. Thank you so much, and have a wonderful night rest. Dr. Titi, you want to say
Yes,
farewell
thank you
word
very
before
much,
we
sir.
go?
Yes,
Thank you so much.
thank you so much
Thank
to all our
everyone.
amazing guests. And thank you everyone for joining. Thank you so much, Dr. Nasir. Thank you so much to the CEO and everybody for your contribution. It was really amazing, and it's a very big call even to us young veterinarians not to just sit back, but take action, take steps, seek mentorship. This is a very amazing session even for me. So thank you so much, everyone. It's such a pleasure to be here.
All right. Good night, everyone. See you on the next section. Bye.
Good night and bye.
Good night, Dr.
Goodbye.
Nandi.
Good night, everyone.
Good night. Thank you, Dr. Ray.
Dr. Ben, are you there?